Okay guys, so in this video we're going to go through a thoracic manipulation. So Glenn, how would we go about doing this?
So a technique that I like is called the pistol manip. We've got Ben in this position here. It's quite a generalised technique. You can be reasonably specific to the mid-thoracic spine, but I think you're going to get cavitations on several levels usually. Yeah. Really nice if there's just a general stiffness, if people are sitting at desks and they're flexed over a lot of the time and they've got that extension restriction. The contraindications to manips we'll put on the site, so make sure you read through those and choose your patients appropriately. But we start off with this position. I like to bend the knees up so it kind of locks the lumbar spine to a certain degree, and then I'm going to ask Ben to grab around his body for me. Just position his hands, keep that nice and tight there for me, Ben. Now what we're going to do, I'm just going to have this kind of hand position with my left hand. I'm going to roll Ben towards his left. I'm going to palpate into the mid-thoracic spine. Obviously I'd have done my pavums and my pivums prior to this stage. And then I'm just going to roll Ben onto my hand. When he's on this position here, get him to relax, nice deep breaths. I'm going to bring his arms down to create a little bit of pressure. Then I'm just going to sink my body weight there. And we get a nice cavitation. Obviously the effects of this are quite short-lived. Relaxation in the muscles around the area, but it gives you a nice window to do further moves and to increase your exercise tolerance. Yeah,
I think with manips, one of the things when I was learning how to do them, a couple of things just to bring up, which I think everyone happens to quite a lot of people. First thing, a lot of people, their hands hurt when they do it, so I think what you need to do, and I found really good, is getting a really quite tight grip through here. If you let your fingers go loose, then you're guaranteed you're going to hurt your fingers when you're doing this basically, so you need to be in tight. The other thing is the actual positioning. Your fingers and your this part of your hand essentially are trying to block the facets, aren't you? So you're basically going, if you want to try and to be specific with it, you're putting those 2 points, those contact points just through here, onto the facet below the area where you want to manip. Again, like Glenn mentioned earlier, you can't be completely specific, but you can, your aim is to be as specific as you possibly can be. I always find those 2 pointers when I was first learning, those are the 2 things I
I think the angle that you apply the force is important as well. So a lot of people will just put their hand there and try and drop down. And the way it was explained to me, which I always have in my mind, which I find quite useful, is the shape of a banana. So you're kind of following that shape of a banana with your pressure and making sure that you're winding up the tension properly with the hands and the body. So bringing Ben into a slight flexion adds that stiffness into the area where you want to manip, and if I flex him more, it's going to bias lower down the thoracic spine. So if I was trying to work a little bit lower, I'd have flexed him up a little bit higher. So just the setup, as with all manips, if you don't get the setup right, you're starting at a disadvantage straight away. Yeah, definitely.
And I think that the thrust, they talk about a high velocity, low amplitude. So essentially you're doing it fast, but not a huge amount of movement. So you should wind it up to that point where you feel, once you've done a few of these, you'll feel when you feel like it's going to go. So you wind it up to that point, and then it's a short, sharp thrust. It shouldn't be putting all your weight through them and actually really dropping down too much. It should be just really able to just go quickly because you're doing that high velocity thrust basically. Okay, so that's a technique for the thoracic spine manipulation technique.